her to the main hospital for delivery and induction because she may have DIC, she may bleed to death, and she lost the baby, now we can lose the mother, and she's a young girl. So there is a lot to do, a lot to do.
Dr. Adele, we have a shortage of doctors, no? And I don't know how many of them know how to perform a C-section. Could you make an appeal to our doctors here in the country? How do they get to be able to perform C-section? Can you be a doctor who can perform C-section without being a surgeon, or you have to be a certified surgeon to be able to perform a C-section?
You have to be an OBGYN specialist to perform a C-section.
So an ordinary doctor, a general practitioner cannot?
A general surgeon can be trained to do it. Maybe we can train family practitioner how to do, or GP, how to do a normal delivery, and what are the sign of any problem or complication to call the specialist.
Yeah, the fetal distress that you called it. Yeah.
Yes. This is the time that you have to call a specialist. However, to really do a C-section, you have to be in a surgical specialty.
Oh, I see. And how long does it take to train to be to have that surgical specialization?
It depends from country to country, from 5 years to 4 years residency in obstetrics and gynecology, so you could be a specialist and you could be able to perform a cesarean section.
Would you be willing, Dr. Adele, to be a resource teacher for our OB-GYN Institute that will hopefully train more competent Filipino surgeons who can do C-sections?
First of all, it's my duty as a doctor to do teaching, surgery, whatever I'm needed as a human being.
Yes, sir.
To my fellow humans. And number two, it's a pleasure. Number three, I love this country, and you know how much I love kababayan.
Yeah, he calls himself kababayan. And if he had his wish, he wants to reside here. So he is trying to fix his investor's visa. He will be investing in the Philippines to form a medical center, especially in Estancia. That's correct,
in
Doctor?
Estancia, and I want actually to have many, in many provinces, many islands, and many clinics in remote area. That's where we are really needed the most, is in the remote area.
The remote areas. And we really do encourage a lot of our doctors out there to try to see whether you might pursue surgical competencies in doing C-sections, which you said takes 3 to 4 years of specialization before you can actually be a good
a specialist.
A specialist, yeah.
However, if any doctors in a surgical specialty, I'll be more than happy and gladly train them pro bono how to do a cesarean section, how to do a forceps delivery, how to do a vacuum suction cup delivery. I mean, it's simple, it's easy, but yet you have to know when, if you run into any complication, you really have to know what you are doing. And especially in a C-section, you may have bleeding that you have to control. So
that's where the blood transfusion or the blood donations are badly needed, because normally when there are complications, the mother loses a lot of blood.
Very rarely. I mean, if you do a normal cesarean section with a specialist, we know how to not to cut the uterine artery that bleed like a faucet. We have to respect. We know where it is,
and you avoid.
You avoid that.
Okay,
however, if you get any normal, even if you do a C-section and you have placenta accreta, placenta accreta simply the placenta, the afterbirth is
the afterbirth, yes.
Stuck in the cervix.
And it doesn't want to withdraw. Yeah.
It's completely invaginated in the cervix, and even if you do a normal C-section and you close, that patient will still bleed. And I had 3 cases like this in my training. And we have to, after the C-section, we have to do trachelectomy. We have to just clamp and cut the cervix to save the mother. So, and we used, I remember I was at University of Baltimore in Maryland as a chief resident, and we used 10 units of blood, and it was available in a big center. So it's rare, but if this will happen in a remote area and we don't have any blood, definitely we're going to lose the mother.
Well, Dr. ADEL has given a lot of challenges. I know for one that the Philippine Red Cross really is trying to actively solicit blood. But I would like to make a special appeal to our cable partners of Global Destiny GNN, because of the importance of having a blood bank and the available inventory of the different kinds of blood to be available in your respective localities might be an advocacy our Global News Network partners may want to undertake. For our part, I'm making an appeal to our schools of medicine on how we can encourage more doctors, more midwives to take on the profession, because it's very badly needed in a country that is growing so fast in terms of population. You know that in the provinces we don't have that much television or activity, so baby making seems to be very popular, and this is the reason why we have one of the highest population growths in Asia.
And these are the people who really we need to educate them.
Yes. Maybe I will call on Philip Chen, Cora Dakong, Arnel, our director, if we can have more citizen education through GNN, because really client awareness of what they can do at their own personal circles without waiting for the formal hospital structures to get built. But I would also like to appeal to our local government officials, our newly elected officials, from the mayor to the councilors, if you can also try to take care of your young mothers and children through proper citizen care education, I think our country will be a lot more better off when it comes to reducing the morbidity and mortality that we're saying. 11 mothers perishing every day because of childbirth, because of lack, is really so sad. Well, Dr. ADEL, we're coming to the end of our episode. Thank you so much for gracing and honoring Pinoy Matters with your presence. We hope to be able to have you back again when you do already stay here on a more permanent basis. I'd like to reserve the next few minutes to you to make an appeal. We're seen from Mongolia to Indonesia through our cable partners. Can you please make your own message as to how we can improve the caring for our mothers and infants?
First of all, I'd like to say that if you personally, Dean, can organize, or any of the local government can organize any seminar or informal seminar teaching in any province, I'll be willing to come and fly here and do that week or the 2 weeks, whatever it takes, to educate from the patients, the nurses, the midwife, to the local doctor. Religion as Christian, we should help each other and we should help the poor. That's my pledge to all of you, and I'm available to all of you at utmost power I have. That
he has been delivering medical missions all over the world. In fact, he just came from Germany last month for 4. We are really blessed that GNN enables us to have the global reach. That's why we have their company. We hope you keep on watching the business portal. We're here to connect you to the world of business.